rules for the competition, but I'll go over the buzzer part of it, and then we'll go from there. So the competition rules and instructions. There are 2 rounds per competition, a single Jeopardy and a double Jeopardy round, and a final Jeopardy question at the end of the double Jeopardy round. There are 5 categories in each round with 4 questions in each category. A total of 60 minutes is assigned for the 40 Jeopardy questions. And then there is a 5-minute break assigned between the single Jeopardy and double Jeopardy round, where I'm going to give an audience question while you have a 5-minute break to re-strategize or change your electronic buzzer device. So I'm going to go through the buzzers, and I'm going to give enough time for you to test it. So can I have everybody else on mute, please, while I'm speaking? Thank you. There will be 1 buzzer for each team. That is, only 1 team member can log on to the online buzzer system. Use the buzzer to indicate that your team would like to answer the question. The buzzer controller will lock out the buzzer system until the moderator has completely read out the question. So I'll wait until the question is ending, and then I'll open up the buzzer. So the online buzzer turned gray during the lockout period. So when it's locked out, it's gray. Once the moderator has completely read out the question, so there will be a question and then the options. I'll also wait for the options to complete if there are options on the question tag. Each team's online buzzer will turn red when I open it up, indicating that the buzzer system is open. The team's online buzzer will turn green once the team has successfully buzzed in. We're going to go through this buzzer system to test out. That's why we use the opportunity now. All teams can buzz in when the buzzer system is open. Each team buzzes into the system. The controller automatically receives a timestamp, which I'll be able to view here, indicating which order they came in. The first is the fastest team, the second fastest team, and the third fastest team. There are 7 seconds after the question has been completely read out. The buzzer controller will indicate to the moderator or the audience the first team to have buzzed in. So as soon as I hear that, 7 seconds after the question has been completely read out, right, I will call out which came through first. And the team must provide the answer to the Jeopardy question. If you answer the question correctly, moderator will count it as right, and then you'll get the points, and then we move on. If you answer wrong, then we go to the second fastest buzzer person, and then we go through it for the third fastest. So only 3 teams. Got it? Any questions so far? Okay. Only a total of 3 teams identified by me in the buzzed in timestamps will have the sequential opportunity to answer the Jeopardy question. If the correct answer has not been provided after these 3 teams have been called upon, the moderator will provide the answer to the audience and return to the game board. Okay. The buzzer control, if no team correctly answers a question, the team which had the control for the unanswered question retains the control of the board. And the moderator will go through that to make sure that everybody is in place. I will be assigning 25 minutes per round. So 25 minutes for the single Jeopardy, 25 minutes for the double Jeopardy. And between the 25 minutes, I'll have 1 audience question and then the final Jeopardy. So we want to keep it on time for everyone. If you have any questions, please contact me via the chat box. So you change that to my name. Last name is Rao. I'm also going to provide my cell number, which I learned that if I am not able to visualize the chat box, you can take my phone number. My phone is here with my chat, with my text on, so I can answer that. And at that time, as Ketchy said, we can take a timeout, right? And then we can test that buzzer. We don't want anybody to not have the opportunity because of any technical difficulties, okay? But no additional time will be added to the game schedule to accommodate these timeout sessions, and hence we don't want to interrupt multiple times. During this session, I'm also going to stop for a second or so and ask and make sure everybody's buzzers are coming through so that we don't have any teams not having the chance to go through it. Any questions so far?
Yeah, good morning, Dr. Rao. Question, the buzzer will become available at the completion of the question, or will the gray out be available during the question being read?
That's right. So at the completion of the question, if the moderator says this particular answer is, so once I hear the last word, then I open the buzzer and then give an opportunity for you to come. So it'll be grayed out while the question is being read, and then it'll turn for the opportunity for you to get through that. Does that answer the question?
It does, thank you.
This is team 4. I just wanted to verify, we switched devices. I just wanted to verify you can still hear us fine and we're still looking okay because we just changed devices, that's all.
Yes, we can hear you loud and clear. And we can see you.
Thank you.
So Kechi, should I open up close the game and then test the buzzers?
Yes, I think so. Team 6 is raising their hands. What's going on? Team 8 was raising their hand.
Yeah, just a quick question. I want to clarify. Is there a penalty if we don't answer in the form of a question, or is that the only way to answer?
No penalty if you don't answer in the form of a question. We'll forgive everyone. This is COVID-19. We're glad you're here. Okay. All right, let's go ahead and test these buzzers. Go ahead.
I'm going to send the website and also the code. So the website is ccg.buzz, B-U-Z-Z, code is 47C1. I'm gonna give a couple of minutes for you to put that in. The buzzers are off right now, so I'm gonna open it up and then we'll make sure that everybody comes through.
If you're using a cell phone for your buzzer, disconnect the sleep mode. Because if your cell phone goes into sleep, it will kick you out of the buzzer system. So if you're using a cell phone to run your buzzer, make sure that your phone remains on. No sleep mode on the phone.
Okay, so they're coming through. As they are coming through, I'm going to let everybody know. Please name your teams with your team number. So, for example, Delaware should be naming their team as Team 1. So I have Ohio Metro Health. Ohio Metro Health has names itself as Farhan, so they have to change it. Cleveland Clinic should change their name to Team 3. Ohio State has team name as Ohio State and name as Alex Meyer. Please switch up and change that to Team 6 on the name. Team 4 Metro Health is correct. MUSC Team 7 has Ishan as the name and MUSC as the team. I want you to change it to Team 7 as the name. I don't see others yet, so I'm going to refresh again and wait for everything to come through.
If you're having difficulty renaming your buzzer, just log out and log back in with the correct order of name.
Thank you, Liana. So I have Ohio Metro Health Team 4 has done it right. Ohio State Team 6 has done it right. Cleveland Clinic has done it right, but they have to swap again. Team says Team 3 and name says Cleveland Clinic. Please swap it out. Aurora, same thing, swap out name as Team 10, team as Aurora. I don't see others, so I'm just waiting for them to buzz in.
Can you see us?
Team 3 Cleveland Clinic is correct. And which team was that?
Team 5 Canton.
Team 5 Canton is correct. I see them and they are good.
Thank you.
Team 1 has to change from Amar as the name to Team 1, and then team should say Delaware.
Hi, can you see us as team 2?
Team 2 is not there yet. I do not see team 2.
And you see team 8, sir?
Team 8 is not visible. Team 2 is visible now. They should switch around. Team 1, Delaware is correct. Team 8, Prisma is correct.
Can you see team 7?
Team 7 is not there yet. I see team 10, Aurora.
What should be the name for team 2? Just team 2?
I see, I do not, I see team 2, but they should just switch it around. And then I'm going to refresh it again. One more try. Team 7 also should switch around, and I do see them. So I'm going to refresh again, and then we'll go through again. Team 3, Cleveland Clinic, I see them and they are in the right order. Team 6, Ohio State, I see them and they're in the right order. Team 4, Ohio Metro Health, I see them and I see them in the right order. I'm waiting for others to pop up.
Just one question. If by mistake the buzzer, we end up pressing the buzzer during the time it's grayed out, is the buzzer locked for a longer time after it's open?
No.
It just doesn't record it at all. So if you're pressing it while it's gray, nothing's happening until it turns red for you. Then you to go through.
Yeah.
Thank you.
I see team 2, Suma, in the right order. I see team 7, MUSC, in the right order. I see team 5, Canton, in the right order. Still waiting for the other teams.
So when you put your names in the buzzer system, click on join, and then that way he gets your name in his system. So once you put in your name, your team names, join.
Are you still not seeing team 8, sir?
I do not see team 8. I see it now, and it's the right order.
Well, what about team 9?
I do not see team 9 yet.
I think when I hit buzz is when you see it. So if nobody is being seen, try and click buzz, it may work.
Okay. Thank you.
Do you see team 9?
I do not see team 9 yet. I see team 9 now. Thank you. I'm still waiting for team 10, team 11. I see team 10, Aurora, in the right order.
Team 11, have you joined the buzzer system?
I don't see team 1 also, and team 5. I mean, I saw team 5, I'm sorry.
Hi, for some reason we lost our camera. Is it okay to leave and rejoin?
Yes, you can leave and rejoin. We have time. So Sunil, who are you missing right now?
So I do not have team 1.
Team 1, okay. But you have team 11 now.
They are not there yet.
So team 11, do you want to join the buzzer? We can't see you on the buzzer, which means you will not be able to answer any questions during the game.
So team 11, University of Wisconsin, we do not see you on the buzzer.
We have it on the app that we should be on there.
We're not seeing you. So what, do you want to log out and try and log back in? Because if we can't see you, your answers will not come in.
It's 47C1. Okay.
Have you clicked join?
I did. I just did it again.
Okay, I'm going to refresh it here. So give everybody a chance. Go ahead and click. So consider this is the end of the question, and I'm opening up the buzzer. So go ahead and everybody buzz in. So they're coming through. So
Everybody should buzz in, please.
Everybody buzz in. Team 11, switch around. I do see team 11 now. Chris Bertrell. please switch around and make your name as Team 11 and team as team as University of Wisconsin. I do see all the teams except Team 11. Everybody is in the right order. I see 6, 5, 7, 9, 4, 3, 2, 10, 1, 8, and then Team 11 is switching around. So one more try, last try. So the question ended, simulating the Jeopardy, and I'm going to open it up. Go ahead and everybody buzz in, please. So everybody coming through, I have 4, 6, 10, 9, 1, 2, 3, 8, 5, 7, and I got 11. Okay. Did you get it?
Perfect.
Go through it. Yep. Everything looks good. Catchy.
Good. So let them know the penalties about the buzzing.
Okay. So the penalties about the buzzing. Basically you get the first control that I call out. They get the chance to answer the question. 7 seconds later, if you don't answer, then it comes there. And the penalty part, can you go over it, Ketchy? I know it's there somewhere. I don't want to.
That's okay. So if everyone has a chance to buzz in, however, only the first or the fastest 3 teams will get the chance to answer. So there's a timestamp for everybody's buzz that comes through. Dr. Rao will identify the fastest team first. So example, team 4, he will call upon that team to answer. If the team decides that they don't want to give an answer because they don't know the answer, or they are not sure of the answer, or they give a wrong answer, they will lose the marks for that question. Dr. Rao will then identify the next fastest team, example, team 6. He will call upon that team. The team will have the opportunity to answer. If the team gets it wrong, he will then call the next team until 3 teams have been identified. If none of the 3 teams gets the answer correct, Dr. Clark, who is the moderator, will show the answer for the audience and move on. Do not answer a question if you're not called upon. So if you answer a question without your team being identified, you will get a warning for the first offense. The second time it happens, we'll deduct marks from the team. So don't answer unless you're called upon. If you are not called upon at all, after the first 3 teams have been identified, you will not lose marks for that question. So only the first 3 teams either get the score or lose the score, but everybody else is not deducted or penalized for that question. Is that clear? Okay. All right, I'm going to keep.
Catchy, I believe we lost you.
Quiet, Brian. I'm going to let you do some few marks for the teams. Okay, Dr. Clark, can you hear me? Sorry.
Yeah,
you can go ahead and take over.
Yeah, I can hear you now. Hey, welcome everybody. My name is Brian Clark. I am a assistant professor at Rush University in Chicago. Welcome. I remember doing this a couple of years ago. There's a lot more teams in this one probably than the one I participated in, so appreciate your guys' flexibility with this. There's a couple of things that I just wanted to go over. You know, Sunil went through a lot of the things that are important for you, but just a couple of extra reminders. During the course of the game, I'll do my best to keep track of all the teams and who is the most recent person to answer. If for any reason you have any questions or concerns, you can, I think, send a message. I'm trying to figure out the best way to do this.
Could you be louder? Could you be louder a little bit, sir?
Can you hear me okay?
Yeah.
Okay. All right. I was just saying that I'll do my, okay, thumbs up. I'll do my best to keep everything moving smoothly. Along the course of the game, I'll say that there is one question in particular where you'll have to do a calculation. So you may be able to do this in your head, or you may be able to use a calculator on your phone, just as an FYI ahead of time. When it comes to the daily doubles, it will be only the team that selected that particular question that will be able to answer. And when it comes to the final Jeopardy, only the teams that are in the positives will be able to answer the question. Well, we'll get to that once we reach that point in the game. For the final Jeopardy also, I'm gonna have you all send me private messages in the chat with your answers and your wagers. So just make sure when you're sending that to me in the private messages that you're sending it just to me and not to the entire audience. Otherwise, everybody will be able to see what those things are for you. Okay? Any questions or any concerns? No? I'm going to take silence as a no. Anything else, Nkechi, you think I should mention?
No, I think we're live. I think you can go ahead and introduce yourself and your team and the crew to the audience. Go ahead. All the best.
All right. Well, welcome everybody. My name is Brian Clark, and I am an assistant professor at Rush University in Chicago. I want to welcome all of you all to our Fit Jeopardy competition during a pandemic. So we appreciate you all for joining us. We should have a great game today. We have a lot of great participants from South Carolina, Wisconsin, Delaware, and Ohio. We are going to get started with the game in a short while, but one thing I wanted to do is go through and have everybody on the teams introduce themselves maybe, and just say, which program you're in and what your plans are in terms of career. We can go fellow by fellow, and it doesn't have to be a long discussion. It can just be maybe something brief. So maybe we can start with team 1 from Delaware.
Hi everybody, I'm Deepthi. I'm a third year general fellow. We are the Delaware team, and I'm going into heart failure next year.
Excellent.
My name is Amar. I'm one of the second years. I'm planning on doing non-invasive after I finish.
My name is Jay Patel. I'm one of the first years. I'm still undecided.
Christiana.
Excellent. Team 2 from Summa Health.
Yeah, hi. My name is Simon Kobrossi. I'm a third year and I'm going into heart failure next year.
Hi, I'm Rupananda. I'm second year from Summa, and I'm applying for heart failure fellowship.
Hi, my name is Wafiq Itani. I'm a first year fellow at Summa and going to apply for intervention next year.
Awesome. Team 3 from Cleveland Clinic.
Yeah, hi, my name is Nico. I'm one of the third year fellows at the Cleveland Clinic, and I'm going into interventional next year.
Hey everyone, my name is Amit. I'm a third year fellow. I'll be staying for intervention as well.
Everyone, I'm Zach. I'm a third year fellow as well. I'll be doing heart failure here and then critical care.
Awesome. All right, next we can do team 4, Metro Health, and Case Western.
Hi, my name is Farhan. I'm a second year fellow. I'm interested in I'm interested in non-invasive cardiology.
And I'm Enrique. I'm a third year fellow, and I'm going into non-invasive next year.
Hello, everyone. My name is Ahmed. I'm a first year, and I'm thinking about interventional.
Team 5, Canton Medical Education Foundation.
Hi, everyone. My name is Karup. I'm a third year fellow, going to be a non-invasive cardiologist.
Hi, I'm Joe. I'm a second year fellow here. I've been interested in interventional.
Hi, my name is Lakshmi. I'm a third year fellow. I'm going for a general cardiology next year.
Great. Team 6 from The Ohio State University.
Hi, I'm Jeremy Slivnik. I'm a third year cardiology fellow, and I'll be going into advanced cardiac imaging.
Hi, Bill Marshall, third year fellow, going into adult congenital.
Hey, Alex Meyer, second year fellow, doing interventional.
Team 7 from MUSC in South Carolina.
Yep. Hi, I'm Matt. I'm a second year fellow. I'll be doing interventional.
I'm Jazz Chief. I'm a third year fellow, but doing general cardiology.
I'm Ishan. I'm a third year fellow as well, and I'm going to be doing general cardiology next year.
Jazz, I think I know you.
That's right. I'm from Maryland as well.
That's right.
Yes, indeed. University of Maryland. Team 8 from Prisma Health.
Hi, I'm Jared. I'm a third year fellow. I'm going into interventional next year.
I'm Katie.
Couldn't quite hear you there.
Hi, I'm Katie. Katie. I'm a first-year fellow. My career path is still undecided.
Okay. Nothing wrong with that.
My name is George, a first-year fellow as well, and have an interest in EP.
Cool. All right. Team 9, Medical College of Washington, or sorry, Wisconsin. Oh, I think you all are on mute. Yeah, still looks like you're on mute.
Can you hear us now?
Yep, we can hear you now.
Oh, sorry about that. My name's Dave, going into imaging and non-invasive cardiology.
Hi, my name is Ram. I'm going to non-invasive cardiology. I'm Leo Gazdecki. I'm a first year. I'm going to be going into heart failure.
Great. All right. Team 10, Aurora Healthcare.
I'm Dan. I'm a third year, and I'll be continuing the intervention.
I am Rafat. I'll be doing intervention next year.
Hey, I'm Ali, and I'm doing EP next year, third year fellow.
Excellent. All right. And last but not least, Team 11 from University of Wisconsin.
Hey, I'm Joe. I'm a third year fellow going into interventional or nephrology if I actually get fired.
I'm Chris. I'm going into EP next year.
I'm Anupama, one of the second year fellows. I'm doing non-invasive.
Great. I think that's everybody. Well, thank you all for introducing yourselves. We're going to get started just shortly. One thing I do want to put out there as a reminder to the people in the audience that during our break between the single Jeopardy and double Jeopardy rounds, so there will be a question for the audience where we'll be giving away a $30 Amazon gift card. So stay tuned for that. Okay. All right, so let's get started. I'm going to share my screen. Okay. All right, so we can just jump to the board. I won't let it all play. All right, so we can start out with systemic disorders for 100. Okay. All right. So provide the appropriate definitions for BMI. Normal weight, BMI is 18.5 to 24.9 kilograms per meter squared. For obesity, BMI is greater than blank.
Team 6, Ohio State.
BMI greater than 30.
That is correct. Excellent job. Oh, sorry about that. Yep. So obesity is defined as a BMI that's greater than 30, like you said. Overweight is defined as a BMI that's 25 to 29.9. And normal weight is defined as a BMI that's 18.5 to 24.9. Right. So team 6, you have the board.
We'll just keep going on systemic disorders.
Okay. So for the primary prevention of cardiovascular disease, it is recommended that adults participate in at least blank minutes per week of moderate intensity exercise. And this is an ACC AHA class 1 recommendation.
Team 4, Ohio Metro Health.
Okay. Oops.
What is 150?
That is correct. Looks like there's just a little bit of a lapse. Okay. So absolutely correct. What is 150 minutes? And again, class 1 recommendation from the ACC and AHA 2019 primary prevention cardiovascular disease guidelines. All right, so you all have the board. Team 4.
We'll do systemic disorders for 300, please.
Okay. All right. So risk enhancing factors for cardiovascular disease have been described. Provide the correct description of these risk-enhancing factors. Their high sensitivity CRP, greater than or equal to 2 milligrams per liter. ABIs less than 0.9. ApoB level, blank milligrams per deciliter.
Team 10, Aurora.
More than 50? Oh, sorry, more than 130.
Sorry, say it again, I didn't quite hear you.
More than 130?
That is correct. Sorry, again, a little bit of a lag. So just as you said, greater than or equal to 130 is one of the risk enhancing modifiers. I won't go through this entire chart here, but in the 2019 primary prevention guidelines, it gives all of these risk factors as risk enhancing that you should take into consideration whenever you're risk assessing patients. All right, so we can go back to the board, and team 10, board belongs to you.
We'll continue with the systemic disorders 400.
Okay. All right. So diabetes specific risk enhancing factors for cardiovascular disease have been described. Provide the correct description of this specific diabetes risk enhancing factor. eGFR less than 60 milliliters per minute per 1.73 meters squared. ABI less than 0.9. Albuminuria, blank micrograms albumin per milligram creatinine.
Team 4, Ohio Metro Health.
What is 300?
That is incorrect.
Next team is Team 5, Canton.
What is 100 microgram albumin?
That is incorrect.
Next team is Team 3, which is Cleveland Clinic.
Is it 30?
That is correct. It is 30.
So Team 3.
Yep. Sorry, a little bit of a lag. That's why. So like you said, greater than or equal to 30 microgram albumin per milligram creatinine. And again, this is from the 2019 primary prevention cardiovascular disease guidelines. All right. So team 3, the board belongs to you.
We'll go with hypertension at 100.
Sorry, I didn't quite hear you.
Hypertension for 100.
Got it. All right. So moderation in alcohol intake is recommended for the prevention and treatment of hypertension. The recommended limits for daily alcohol intake for men is blank and for women is blank.
Team 6, Ohio State.
2 for men, 1 for women.
That is correct. Sorry, just taking a little bit of time. It's fairly self-explanatory. Like you said, 2 alcoholic drinks for men and 1 alcoholic drink for women. Just give me 1 sec. All right. So we can go back to the board, and team 6 belongs to you.
We'll go pulmonary circulation for 100.
Okay. All right. So pulmonary arterial hypertension, PAH, group 1 is defined hemodynamically as a mean pulmonary artery pressure of greater than or equal to blank millimeters of mercury, a pulmonary capillary wedge pressure less than or equal to blank millimeters of mercury, and a pulmonary vascular resistance of greater than or equal to 3 Wood units.
Team 6, Ohio State.
Go ahead.
20 millimeters of mercury for pulmonary pulmonary pressure and 15 for pulmonary capillary wedge.
That is correct. So historically, pH was arbitrarily defined as a mean PA pressure of greater than or equal to 25 in the supine position at rest and during right heart catheterization. But based on observations in the resting population, in the population that at rest, the mean PA pressure is approximately 14 millimeters of mercury. So the new definition based on the 2018 Sixth World Symposium on pH switched it from 25 to 20. All right. So team 6, the board is yours.
We'll keep running pulmonary circulation.
Okay. Pulmonary arterial hypertension long-term responders to calcium channel blockers are identified by a positive response to vasodilator therapy. A positive response is defined by a reduction in mean pulmonary arterial pressure by greater than or equal to 10 millimeters of mercury to an absolute value of blank millimeters of mercury without a decrease in cardiac output.
Team 6, Ohio State.
Less than 40 millimeters of mercury.
That is correct. And again, just bear with me. It seems like I have a little bit of a lag between the time when I click the score and it moves on. Okay.
You're unmuted.
So what is less than or equal to 40 millimeters of mercury? All right, so the board is still yours, team 6.
We'll do pulmonary circulation for 300.
Okay. All right, so combined pre and post capillary pulmonary hypertension is defined as a mean PA pressure of greater than or equal to 20 millimeters of mercury, a pulmonary capillary wedge pressure of blank millimeters of mercury, and a PVR of blank Wood units.
Team 9, Medical College of Wisconsin.
Fine. 15 and 3.
That's right. Okay. Team 9, the board will be yours in a second. Again, I apologize, a little bit of a lag here. Okay. Team 9.
Go with pulmonary circulation for 400.
All right. So riociguat exerts its action by stimulating this.
Team 6, Ohio State.
Guanylate cyclase stimulator.
Say it one more time, I didn't quite hear you.
Guanylate cyclase.
That's correct. So riociguat is a soluble guanylate cyclase stimulator. It directly stimulates that particular enzyme independent of nitric oxide. And in doing so, increases the sensitivity of soluble guanylate cyclase to nitric oxide.
1 second, Brian. I just want to make sure everybody has the opportunity. Anybody having issues with the buzzer? I see all of them. All the buzzers are coming through. I actually see all 11 coming through, and I'm giving enough opportunity for everything come through. Okay. Team 5 wants to switch the buzzer, so let's give them the opportunity.
Okay.
Once you switch, let me know, Team 5, and then we will recheck everything. Team 8, we're seeing your buzzers. Team 5, did you switch the buzzer?
Our buzzer switched.
Okay, thank you. I'll test the buzzers out. Go ahead and everybody buzz, please. Opening the buzzer. I got all 11 teams. I have team 4, team 9, team 5, team 1, team 2, 6, 8, 7, 10, 3, and 11. Everybody's here. All right, let's proceed, Brian, please.
All right. I believe it was team 6 who was controlling the board.
We'll go critical care for 100.
Okay. The echocardiographic criteria for Epstein anomaly includes apical displacement of the septal leaflet insertion site by greater than or equal to blank millimeters per meter squared relative to the anterior mitral valve leaflet insertion site.
Team 6, Ohio State.
0.8.
That's incorrect.
Team 4, Ohio Metro Health.
What is 8?
That is correct. So team 6 were close, just off by 1 decimal point. So pretty self-explanatory again. So the echocardiogram requires apical displacement of the septal leaflet by greater than 20 millimeters or greater than 8 millimeters per meter squared. And again, I don't quite know why this is going so slow, but we'll move along in a second. All right, so team 4, you have the board.
Critical care medicine for 200, please.
Okay.
Before we proceed,
Yes.
I believe team 6, we did not deduct score.
Oh, apologies.
You can use the adjust scores button and adjust their score, team 6.
6. That was for 100, so. Change. Whoops, I'm not quite sure. Sorry, give me 1 second. It's like I'm having a little bit of trouble actually clicking the adjust score. Give me
If I can just, you can probably click on any of the 100 that's already been clicked. So pulmonary circulation 100 that's blank, you can click on that.
Yeah. Just seems like it's, for some reason, taking a little bit of time to load, so I apologize.
Dr. Rao, since we have a delay, team 8 would like to, I'm going to switch the buzzer device in the meantime, if that's okay.
Go ahead, please. And then once you're done, please let me know, and then I'll test the buzzer.
Will do.
And that's okay, Brian. If you restart, you can actually switch your screen to Joe, since Joe has exact the same scores.
Okay.
And if Joe takes over the scoring system, Joe, if you're okay with that, you can continue the game. And then when Brian has a running back, he will take over. Because yeah, he's going to lose all the scores once he.
Yeah.
And then at the break, we'll give you the new scores. So what will happen, Brian, is we'll have you, Joe will take over, and then at the break, we repopulate your scores at that time.
Okay. All right, so I'll come off of this.
Dr. Rao, we made the switch.
Okay, I'm going to test out the buzzer system. Go ahead, everybody buzz in, please. I see all 10 teams. I don't have all the 11 teams. So I have team 4, team 3, team 7, team 9, team 2, team 5, team 8, team 6, team 11, team 10. Can team 1 buzz in, please? I got team 1. So I got all the teams. Thank you. Team 8, your buzzer is working and it is appropriate. Thank you. All right, Brian, Ron.
So thank you, Joe.
Sure.
All right, so we adjusted the score for team 6, and was it team 2?
Team 4 has the lead. Has the board.
All right, so team 4, you have the board.
We'll do critical care medicine for 200, please.
Critical care medicine for 200.
Okay, so percutaneous or surgical intervention, make the right choice. A 57-year-old man presents with chest pain and an abnormal stress test. His coronary angiogram reveals anomalous origin of the right coronary artery from the left sinus of Valsalva. The recommended management strategy is?
Team 1, Delaware.
What is surgical intervention?
I'm sorry, I didn't quite hear you.
What is surgical intervention?
Surgical intervention, that is correct. Right. So these are the guidelines right here. I won't go through each individual one, but surgical intervention is the correct approach in this particular case. All right. So you can go ahead and select the next.
We'll take critical care medicine for 300, please.
Okay, critical care medicine for 300. Using the revised Ghent criteria, in the absence of a family history of Marfan syndrome, the following criteria is diagnostic of Marfan syndrome. Fibrillin 1 mutation and a dilated aorta defined by a Z-score greater than.
Team 9.
What is 2?
That is correct. So Z-score greater than 2 in this particular case. And here's the revised Ghent criteria. Team 9, you can go ahead and select the next category. And
We'll go to congenital medicine for 400.
Okay. Match the genetic mutation with the aortic disease. Fibrillin 1, Marfan syndrome, ACTA, familial thoracic aortic aneurysm disease, SMAD3, Loeys-Dietz syndrome, and TGFBR2, blank.
Team 4, Ohio Metro Health.
What is vascular EDS?
That is incorrect.
I don't have any other team buzz in.
Okay. All right. So you can proceed to the next slide. So the answer for this one is also Loeys-Dietz syndrome. As you can see on this this table for hereditary thoracic aortic aneurysm disease due to genetic mutation, Loeys-Dietz falls within that category, type 2 specifically. All right, so we can go back to the board. And which team was it?
Team 9.
So team 9, sorry, yes, team 9, you have the board still.
We'll select hypertension for 200.
Okay. The preferred antihypertensive medication in patients with hypertension and thoracic aortic disease is this medication, and it's a class 1 recommendation.
Team 6, Ohio State.
What is ACE or ARB?
And that is, what is that? I'm sorry, I don't have the answers in front of me anymore.
That would be incorrect.
That would be incorrect. Thank you.
Second, next team is Team 9.
Is it irbesartan?
That's incorrect.
Next is Team 4, Ohio Metro Health.
What is losartan?
Hold on one second for me.
Which team was that?
Team 4, Ohio Metro Health.
Team 4. And that was incorrect.
So as we went through all the three,
All right, so what are beta blockers? So it's class 1 recommendation that beta blockers are recommended as the preferred antihypertensive in patients with hypertension and thoracic aortic disease. All right, so we can go back to the board.
Ryan, we'll take 2 more questions.
Okay.
Team 9 has control.
All right, so team 9.
Hypertension 300.
All right, hypertension 300. And that's our daily double. So remember, just the team that selected it is able to put a wager up, and the max that you can wager is 400. So let me know.
We'll wager 200.
200, okay. All right. So a 60-year-old African-American man presents to the clinic for evaluation of hypertension with a blood pressure of 150/90. He has no other comorbidities. His labs show normal electrolytes and renal function, and his transthoracic echocardiogram has a normal EF. His antihypertensive medication should include one of these two classes of medications.
Team 10.
Say,
wait, I thought it was.
Just team 9
So just team 9.
for daily double.
Sorry about that.
Okay. So we'll say thiazide diuretic and calcium channel blocker.
And that is correct. So just as you said, thiazide diuretic or calcium channel blockers in African Americans.
One more question.
Okay.
Hypertension for 400.
Okay. All right, so a 65-year-old man is admitted to the ICU for management of hypertensive emergency with a blood pressure of 190/110. Aortic dissection and pheochromocytoma have been excluded. The recommendation is to achieve a blood pressure reduction by not greater than blank % in the first hour.
Team 11, University of Wisconsin.
What is 25%?
And that is correct. All right. And I think that's all. Sounds like that's all the time we have for the first round. So we can go to our break. We will come back and do double Jeopardy, but we'll have a.
We'll go over the scores, please.
Oh, I'm sorry.
So I'm gonna. I have the here. If I can go over the scores, Brian.
Sure.
Team 1, Delaware, Christiana is 200 points. Team 2, Summa Health is 0 points. Team 3, Cleveland Clinic is 400 points. Team 4, Metro Health, Case Western is negative 700 points. Team 5, Canton Medical Health is negative 400 points. Team 6, Ohio State University is 600 points. Team 7, South Carolina MUSC is 0 points. Team 8, Prisma Health is 0 points. Team 9, Medical College of Wisconsin is 600 points. Team 10, Aurora Health, 300 points. And Team 11, University of Wisconsin, 400 points.
Okay. All right, so we will take our break and have our audience question, and we will return in 5 minutes.
Okay, I'm gonna take over the screen and hopefully get this right here. Do you have this question? Or can I send it to you and you can present it? I just don't want to give out. Or can
For me?
Yeah.
Yeah, I can do it. Let me just open it then.
Okay.
Hey, quick question for the teams. What's everybody using for their means of buzzer? What's been working the best?
Team 6 can answer.
I just have a seizure disorder with my finger, so I
was gonna say, man, I congratulate you guys for how fast, because I don't think there's anything different that I can do.
Obviously, the best connection is probably 200 megabps or something.
Yeah, I think the connection.
5G. We're on the Ohio State Stock Exchange
I
right
think it's
now.
hooked up to a bot and it's just automatically answering. And kudos to you guys. Yeah, that's awesome.
I'm using a laptop and it's going okay.
This is ready for you, Dr. Rao.
Okay. All right. So the audience question for round 2, February 6th. Go ahead, please. Only the audience members should submit their answers in the chat box, which we're going to be monitoring. The first correct answer will win a $30 Amazon gift card. So the question is, this EKG shows. I'll give a second. Okay, I'm getting responses. All right.
You want me to proceed?
Proceed, please. Thank you. So what is an epsilon wave in arrhythmogenic right ventricular cardiomyopathy? I got a lot of epsilon waves as the answers, and also Osborn waves as the answers. So the first one goes to, so many answers, so I have to go back to see the first one. It's from 964099. So unless I don't have all the numbers there. So Catchy, I don't see 964099. It's just a code. Advocate Aurora Abdullah Malik is going to get the gift card. So Catchy, can we make a note?
Congratulations.
Oh, I see we have a controversy from one of our experts.
Yes. So Dr. Marine says epsilon waves generally are seen in V1 to V3, which are right precordial. And the lead that we show looks like lead 2 or 3. So we'll make sure we'll make that correction and depict it right way. Thank you, Dr. Marine.
Thank you, Dr. Marine. 964009, just send us your email address in the chat box, and we will still send you your gift card.
All right. Just bear with me just for 1 second. I'm trying to switch over to another device just to not run into that.
While they're doing that, thank you, Brian. While they're doing that, I am going to test out the buzzers. Is everybody back to their bases? So I'm going to open it up and let's see if everybody comes through. Team 9, Team 10, Team 6, Team 2, Team 3, Team 1, Team 4, Team 5, Team 11. Still don't see Team 7 and Team 8. Team 7 and Team 8, please buzz in.
For the audience member asking for the scores are shown in the screen and the teams are on the chat box.
Okay. Team 8, can you respond? I don't see you guys here. Did you buzz in? I see Team 7 in. Team 8 is not in yet.
Yeah, we buzzed as green. We can't buzz again.
Okay, no problem. So let me refresh it again, and we're going to try.
Or Chrome.
Okay, opening up. I got 7, 4, 10, 1, 8, 9, 2,
7.
and 6.
No,
Don't have 5 yet.
should you refresh it and take code again?
Switch over.
We switched over buzzers to the Cleveland Clinic.
Okay, Cleveland Clinic, Team 3 is in there, but do you want to switch?
We switched.
Okay, yeah, we got it. Team 3 is here. Team 8 is here. The only one missing is Team 5. Canton Medical Health. Don't have them yet. Any input from Liana or Kechi for them to get back on, or do they need to?
Is this for the buzzer?
Yeah.
I'm sorry,
I would
Dr. Rao, what's your question?
I would log out and just log back in as a new user.
Thanks, Liana. So team 5, can you log back out and log back in? One more refreshing and then we should be good. I refreshed again, waiting for everybody to come through. Team 5 is back on. So I see 4, 2, 1, 9, 7, 3, 5, 10, 8. Still waiting for 6. Yep. And I'm waiting for 11. 11, can you buzz your buzzer, please? Otherwise, we can't see you. University of Wisconsin, 11. There you are. Okay, good. Everybody good. Brian, we can move on.
So I'm still having a little bit of technical difficulty. So Joe is gonna manage the screen. I'll just read as we go along, okay?
Thank you.
All right.
I'm going to reveal the double Jeopardy categories.
Okay. All right. So we have cool under pressure, failure is not an option. It's complicated, vascular, and systemic disorders.
11 head control.
All right, so 11, you can go ahead and select where we start. Team 11.
What do you want?
Systemic disorders.
Systemic disorders for 200.
Okay. All right, so a 40-year-old asymptomatic male presents to clinic. He has many first-degree relatives with coronary artery disease, and he has the physical exam findings shown in the image above, or next to the image. The mutation of this gene is responsible for the majority of cases of this condition.
Team 3, Cleveland Clinic.
Is it LDL receptor?
That's correct. So this is somebody who has familial hypercholesterolemia. It's the most common monogenic disorder affecting 1 in 250 people worldwide. And it's caused by an inherited autosomal dominant defect of the LDL metabolism. And there's 3 major genetic loci that are linked to FH. 88% of the cases are because of LDL receptor gene mutation. All right. So team.
Failure is not an option for 200.
Okay. The Paradigm HF trial randomly assigned patients with heart failure to receive sacubitril valsartan 200 milligrams twice daily or enalapril 10 milligrams twice daily in addition to recommended therapy. The results of this study led to the inclusion of sacubitril valsartan as GDMT to reduce morbidity and mortality in this specific patient population.
Team 3, Cleveland Clinic.
What is heart failure with reduced ejection fraction?
Okay, can need it a little bit more specific.
EF less than 40%.
Okay, that is correct. I'll accept that. So LVEF less than or equal to 40% with an NYHA class 2 or 3 who can tolerate an ACE or an ARB. All right, so we can go back to the board and you will have the next selection.
failure is not an option for 400.
Okay. A 25-year-old basketball player was referred to cardiology clinic following a presyncopal episode during a game. He has no family history of heart issues. Physical exam reveals a grade 3 out of 6 systolic murmur heard throughout the precordium, and which gets louder during Valsalva. Imaging is suggestive of hypertrophic obstructive cardiomyopathy. This finding during risk stratification would result in a class 1 indication for ICD implantation.
Team 3, Cleveland Clinic.
IV septum more than 3 centimeters.
That is incorrect.
Team 4, Ohio Metro Health.
Family history of sudden cardiac death.
That is incorrect.
No, this would be
Team 11, University of Wisconsin.
Sorry, may I ask what team that was?
What is the history of sustained VT?
Yes, that I'll accept that one.
The second team that answered incorrectly, what was that, team 4?
Team 4, Ohio Metro Health was the second team.
Okay. And then the one that answered correctly was 11?
11, University of Wisconsin.
Correct.
Thank you.
So in these folks with hypertrophic obstructive cardiomyopathy, sudden cardiac death, sustained VT, or ventricular fibrillation are the class 1 indications for ICD implantation, and that's based on the 2020 ACC AHA guidelines.
Just to clarify, Brian, team 4 was wrong because it's not sudden cardiac death in family, it's sudden cardiac death.
Right. Not because of family history in particular, it's personal history.
Thank you.
All right, team 11, go ahead and select.
We'll take failure is not an option for 600.
Okay. SGLT2 inhibitors have recently been identified in numerous studies as agents with the ability to reduce the rates of cardiovascular death, worsening heart failure, and all-cause mortality in patients with heart failure with reduced ejection fraction. SGLT2 inhibitors exerts their effect on the nephron, on this segment of the nephron.
Team 3, Cleveland Clinic.
The S1 segment of the proximal convoluted tubule.
That is correct. You gave a more specific answer, but proximal tubule is absolutely correct. All right, so team 3, it's your board.
Failure is not an option for 800.
Okay. An 86-year-old African-American woman diagnosed with HFpEF and CKD 1 year ago comes to the clinic for management of recurrent hospitalizations for acute decompensated heart failure. The imaging study to the right would be most likely, to diagnose this patient's condition, and her echocardiogram is on the right.
Team 3, Cleveland Clinic.
The technetium pyrophosphate scan, SPECT.
And that is correct. So this is a patient who has wild type TTR amyloidosis. It results in a restrictive cardiomyopathy, and it's very underdiagnosed and underrecognized in African-American populations. Diagnosis should be suspected in people with heart failure, thickened ventricles, grade 2 or greater diastolic dysfunction on echo, or typical findings on a CMR. And as you said, the technetium pyrophosphate scan can specifically identify ATTR cardiac amyloidosis patients non-invasively. Great job. All right, so team 3, your board.
We'll do cool under pressure for 200.
All right, so that is our daily double. So remember, this is just a question for team 3, and you can wager up to 1,800.
We'll wager 200.
Okay. All right, so this non-pharmacological intervention results in the greatest reduction in blood pressure amongst patients with hypertension.
Is it weight loss?
That is incorrect. We can go ahead and move on to the answer. So the answer is actually the DASH diet. So weight loss is one of the interventions, but the one in particular that has been shown in multiple studies and shown to reduce systolic blood pressure by as much as 11 millimeters of mercury is actually the DASH diet. Okay, I think board still belongs to team 3. So you guys can go ahead and select.
We'll do it's complicated for 200.
Okay. An 82-year-old woman with longstanding hypertension and dyslipidemia comes to the emergency room with a 3-day history of epigastric pain, which was initially severe in intensity, but it has improved to a minor ache since then. Her blood pressure is 99/52, her heart rate's 105. ECG shows anteroseptal Q waves. This finding demonstrated on echo is?
Team 3, Cleveland Clinic.
So ventricular septal rupture.
And that is correct. So ventricular septal rupture or an acute muscular VSD. So this particular finding has a 1 to 3% incidence in cases of MI and higher risk if no reperfusion therapy happens. And it usually occurs within about 2 to 5 days post-MI. Advanced age, female, gender, hypertension, and first MI are risk factors. And the location of the defect depends on the affected vessel. So in this particular case, if it's apical septal, it's typically LAD, and basal inferior posterior septum is typically RCA. All right, so we can go back to the board and team 3 once again. You can go ahead and select a category.
It's complicated for 400, please.
Okay. A 65-year-old woman with hypertension and dyslipidemia on medical therapy comes to the emergency room with 4 days of subjective fever, dyspnea, and worsening intermittent epigastric pain. COVID-19 testing and serial troponins are negative. Chest x-rays unremarkable, and ECG shows lateral Q waves without ST elevations. Echo findings are shown. The diagnosis is?
Team 6, Ohio State.
We'll go with the pseudoaneurysm.
And that is correct. So ventricular pseudoaneurysms, they result from the rupture of the myocardium and are contained by the pericardium. They typically happen 3 to 7 days post-MI. You distinguish them from a true aneurysm by a characteristically narrow neck and an end systolic orifice diameter to maximal aneurysmal diameter of less than 0.5. All right, great job. So team 6, the board is yours.
We'll go with complicated for 600.
Okay. An 85-year-old man with hypertension, dyslipidemia, and PAD comes in with an end STEMI. He undergoes a coronary angiography with a PCI to the mid-LAD via femoral approach. 4 hours post-procedure, he develops hypotension and groin discomfort. The most likely cause of his signs and symptoms are?
Team 4, Ohio Metro Health.
What is retroperitoneal bleed?
That is correct. I'll allow that. I won't go through all of this in particular, but it can happen in cases or in 0.04 to 0.5 cases, becoming less common, of course, because of radial access, but it's something that should be suspected if a patient comes in with unexplained hypotension, progressive hemoglobin drop, flank or suprapubic pain, and abdominal tenderness, and should get CT scan in order to help with diagnosis, managed with volume resuscitation, stopping anticoagulants, manual compression, and potentially surgical intervention. All right, so team 4, you have the board.
We'll do it's complicated for 800, please.
All right, so a 57-year-old woman comes to the ED with a 2-hour history of worsening abdominal pain, which began after dinner. On exam, she's normotensive and she's diagnosed with an inferior STEMI. She's given unfractionated heparin and nitroglycerin intravenously. She subsequently develops profound hypotension, taken to the cath lab urgently. The condition that most likely caused this patient's acute deterioration is?
Team 3, Cleveland Clinic.
What is RV infarction?
And that is correct. So it complicates up to 40% of cases of inferior MIs. It's typically seen in cases of severe proximal RCA disease, and the treatment is early reperfusion, maintaining preload, optimizing afterload, and ionotropic support, as well as trying to maintain AV synchrony and avoiding hypoxia, as well as PEEP, which will increase your PVR. So great job. All right, so team 3, the board is yours.
We'll do cool under pressure, 400.
Okay. So a 38-year-old pregnant woman with dyslipidemia and uncontrolled hypertension is admitted with severe preeclampsia. Her blood pressure is 193 over 121. Guideline recommendation is to reduce her systolic blood pressure to blank millimeters of mercury during the first hour. And this is a class 1 recommendation.
Team 6, Ohio State.
140.
And that is correct. So I won't go through this entire flow chart, but less than 140 millimeters of mercury is absolutely correct in this particular case. All right, so the board is yours.
We'll just do cool under pressure for 600.
Cool under pressure for 600. And that's the daily double. So remember, this is just for team 6 to place a wager. And you can wager up to the maximal amount of that you do have right now, which is 1,400. What would you like your wager to be?
We'll do, what does that even mean?
We'll do a true daily double.
Say it again.
We'll do 1,400.
1,400, okay. All right. So a 49-year-old woman presents for evaluation of poorly controlled hypertension diagnosed 2 months ago. She denied excessive sodium intake or difficulties with sleep, but described frequency of micturition and intermittent muscle weakness and spasms. Her metabolic panel is shown. The next best screening test is what?
Serum renin and aldosterone levels.
I think I'll accept that one. The most specific would be the ratio of those two, so the aldosterone and renin ratio. But yes, those would be the next test to do, and the goal would be to be evaluating for primary hyperaldosteronism. So great job.
Amit, that was thanks to your podcast, actually. So thank you.
All right, so you guys can go ahead and select the next.
We'll do cool under pressure for 800.
Okay. All right, so a 48-year-old woman with hypertension and centrally distributed obesity, which came on in rapid onset, proximal muscle weakness, depression, and hyperglycemia came to clinic. Her medications are maximal dose of amlodipine, lisinopril, and hydrochlorothiazide. Her blood pressure readings at the office and at home are greater than 160 over 85. On exam, she has hirsutism. The initial screening test to diagnose her underlying condition is this.
Team 3, Cleveland Clinic.
This 24-hour urinary cortisol level.
That one, sorry, that one's incorrect.
Team 11, University of Wisconsin.
The random cortisol level.
Random cortisol level, and that's incorrect.
Team 9, Medical College of Wisconsin.
What is a serum AM cortisol?
And that's incorrect. So the answer in this particular case is overnight 1 milligram dexamethasone suppression test. So her clinical presentation is concerning for Cushing's syndrome, and that particular test right here would be the one to choose. All right, so I believe it was team 6 that had the board there.
We'll go vascular medicine for 200.
Okay. All right, so this is the one that I was telling you all you made a calculator for. So the ankle brachial index in the right lower extremity is, and we'll give you just a little bit more time to do a calculation if you need it.
Okay. Can I call out, Brian?
Yes, you can.
Team
I'm
4.
sorry.
What is 1.4?
That is incorrect.
You put the numerator and the denominator.
Team 7.
Oh no, 120 divided by 170.
0.69. Answer.
Team
0.69.
7. Oh my God.
Mute, please. Team
Sorry,
7.
hold. Team 7. I'm sorry, say it again.
0.69.
That is correct.
Idiot, man. Ankle breaker index.
Before your volume is still on. So you're correct. So to calculate the ABI in this case, you want to take the highest ankle pressure, whether DP or PT, and then the highest arm pressure in the left or the right arm. So you would do 120 over 175, and it will give you roughly 0.69. So great job. All right. So Team 7, go ahead and select.
Can we do vascular for 400, please?
All right. So a 28-year-old male with no personal or family history of medical problems was recently diagnosed with Marfan syndrome. An echo showed a dilated aortic root with normal aortic valve morphology and no stenosis or regurgitation. This patient should undergo elective aortic root surgery at this threshold diameter.
Team 3, Cleveland Clinic.
4.5 centimeters.
That is incorrect.
Team 6, Ohio State.
What is 5.0 centimeters?
That is correct. So Marfan syndrome, as we've gone through before, is a heritable disorder that results from mutation of the fibrillin 1 gene. But just to jump ahead, surgical repair of the dilated aortic root is indicated in these particular patients when they get to an external diameter of greater than 5 centimeters. Rapid growth of greater than 0.5 centimeters per year, a family history of aortic dissection at a diameter of less than 5 centimeters, or the presence of significant aortic regurgitation would prompt earlier intervention.
This will be the last question, Brian.
Okay. All right, so Team 3, I believe.
I think we'll do systemic disorders for 400.
That was my mistake. Okay. All right, so a 58-year-old woman with prior gastric bypass surgery and alcohol abuse presents to the ED with fatigue, weakness, and diarrhea. Her blood pressure is 93/60. On exam, there's peripheral edema and a JVD. Labs show an elevated NT-proBNP, a chest X-ray with pulmonary congestion, and a transthoracic image is shown. The vitamin deficiency that can lead to these findings is what?
University of Wisconsin, Team 11.
What is thiamine?
That is correct. So a thiamine or vitamin B1 deficiency. And in this particular case, beriberi, which is a chronic form of it, it's divided into wet and dry. So wet beriberi is probably what this patient is experiencing. It affects the cardiovascular system, and these patients come in with tachycardia, dyspnea, peripheral edema, and a dilated cardiomyopathy. And it can be seen in cases of alcoholism or diets composed of mostly white rice, or in patients with dialysis, chronic diarrhea, or taking high-dose diuretics. And typically the treatment is supplementation of vitamin B1, either oral or IV. All right,
Let's take 2 more questions since we had a lot of interruptions. Let's go ahead, take 2 more questions. We'll play to 11:10 and then go to Final Jeopardy. Thank you.
We'll take systemic disorders for 800.
Systemic disorders for 800, is that what I heard?
800, yep.
All right. So a 40-year-old female with progressive dyspnea over the past 3 months comes to the ED with acutely worsened dyspnea and hemoptysis in the past 12 hours. An echo is shown. Surgical excision reveals a primary malignant cardiac mass. The most likely type of tumor this patient has is?
Team 3, Cleveland Clinic.
Is it angiosarcoma?
That is correct. So angiosarcomas are the most common amongst the malignant primary cardiac tumors, usually found in the right atrium, and they're usually very invasive and metastasize to the lung. Prognosis overall is pretty poor in these patients. And we'll do one more question. Team 3.
We'll do vascular for 800.
Okay. This medical therapy is effective in improving symptoms and increasing walking distance in patients with intermittent claudication.
Cleveland Clinic, team 3.
What is cilostazol?
And that is correct. As we all stated, class 1 indication to use cilostazol in these particular patients to increase walking distance and improve symptoms. Great job. All right, so I think we can move on to Final Jeopardy.
So I'm going to go over the scores and the names of the teams. If it's okay with you, Brian. Joe, are we good on the numbers there?
Correct. I am self-checking myself. So yes, this is accurate.
Okay. So team 1, Delaware, has 200. Team 2, Summa Health has 0. Team 3, Cleveland Clinic has 3,000. Team 4, Metro Health has -700. Team 5, Canton Medical Health is -400. Team 6, Ohio State is 3,200. Team 7, South Carolina MUSC is 200. Team 8, Prisma Health is 0. Team 9, Medical College of Wisconsin is -200. Team 10, Aurora Health is 300. Team 11, University of Wisconsin is 400.
All right.
So Brian, do you want to tell who can play for Final Jeopardy?
Sure, yes. So remember I was saying before y'all that the folks with positive scores can proceed with Final Jeopardy. So that would be Team 1, Team 3, Team 4, or sorry, Team 1, Team 3, Team 6, Team 7, Team 10, and Team 11. Okay. So we can go ahead and proceed to Final Jeopardy. And remember you all, after we read the question, I also will need you, or sorry, before we read the question, I will need you all to submit a wager.
Should you have them submit to me?
Yeah, and since Joe is controlling the board, send him a private message in the web chat, what your wager will be.
So categories congenital heart disease. I'm going to unshare my screen so that I minimize risk of showing the next question, okay?
Wait, we're trying to find you to send you the.
So send to that account, please.
Remember to send the wager just to Joe.
I have gotten 3 responses so far. I'm waiting for teams 3, 6, and 7.
Okay.
Joe, did you not get that? Who do we send them to?
I'm going to send again. Send to this account.
Oh, Joe Tan. Yeah, I think we sent it to you.
There are 2. I'm using one to listen and then another one to score review. So the one that says score review Joe Tan is the one that's officially looking at scores or wagers.
Where is it?
Oh.
My apologies.
How do we submit the answer when it's time?
You submit to Dr. Clark privately.
Wait, so there's no buzzer for this question?
No, there's not.
Team 3, I believe I'm waiting for your wager. If you sent it already, kindly just send it again.
Sorry, yeah, we sent it. We're sent to Jotan.
I can look at the chat specifically for that. I see it. Okay.
Sorry, give us a second. Sorry, I'm from the Cleveland Clinic. Just give us a second. We had an issue with the chat here.
Okay, this is going to be the final wager, okay? I'm not for team 3. So I'm going to reveal the question.
Okay. So this surgical procedure used to correct DTGA via the arterial switch method was the first attempted method of the DTGA repair, but the last to be put into regular use. And remember to send me your answers in the private message. So, good.
This is team 1. Who are we sending the answer to?
To me, the MC.
And I don't have a music prop, so whenever you're ready, Dr. Clark,
Okay.
to provide a cutoff for answers.
All right. So I'll give it about 10 more seconds at the most. So far, looks like I have 5 responses, 6. Okay. All right. All right. I think that's about as much time as we'll give. So we can go ahead and proceed to revealing the response. So Jatine procedure. So this was, like I said, it was the last one to be put into regular use, but the first one to be developed. And I can go through the answers that were sent to me. So team 5, you were correct.
Team 5 would not be playing because they're negative.
That's correct. All right, so let's see. Team 7 was incorrect. Team 3, you were correct.
Sorry, so team 7 wagered $0, so their score is the same. Okay. Team 3 is correct or incorrect?
Team 3 is correct.
Okay, so team 3 wagered $1,000, so their score goes up to $4,000.
Okay. Team 1 is incorrect.
Team 1 wagered $200, so their score goes down to 0.
Okay. And team 10 is correct.
Team 10 wagered $300, so they go up to $600.
And team 6 is correct.
Team 6 wagered $3,001, so their score goes up to $6,201.
And team 11 is correct.
And they wagered $400, so they go up to $800. That should be the final score.
Yeah. Okay. So it looks like, looks like the overall winner is Team 6 with 6201. So great job. Congratulations, you all.
Thank you.
Congratulations.
Wow, this was a photo finish between the Ohio teams. Well, well done, everyone. At Cleveland Clinic, you did great. This was really a tight one between you and Ohio State. Thank you for playing. But it looks like Ohio State University will go on to ACC 21. Delaware, you will be going to ACC 21 as well. Congratulations. MUSC from South Carolina, you're also going to ACC 2021. Well done. And I believe University of Wisconsin gets to represent the Wisconsin chapter. Congratulations to you. But well done, everyone. You guys were all very good. This was a very enjoyable game. I enjoyed it. You guys were amazing.
And thank you all. I appreciate everybody's efforts. Sorry for the technical difficulties along the way, though.
Thanks, everyone. Congratulations.
Congrats to Ohio State. Congrats.
Yeah, thank you.
Thank you. You guys did. You guys were real hard.
That was a great
You guys
game.
did a great job. Gotta go ice my clicker finger now.
All right.
Brian, stay on a bit and